Hi, my name is Madison Tenclay,
And my name is Blaine Schmidt.
and we researched the topic patient satisfaction rates between nurse practitioners and physicians or medical doctors. The question that we use to guide our research are what are self-reported patient satisfaction rates of people below 65 years of age when receiving care from a medical doctor versus a nurse practitioner?
We decided to pick this topic because we know there's currently a stigma that surrounds the field of advanced practice nursing and the qualifications that they have. Before both of us entered the nursing program, we both carried this stigma when receiving care from an NP, and we questioned their abilities and how they compared to an MP, or an MD, sorry.
And after going through nursing school and learning more about the scope of practice of nurse practitioners and also having an interest to possibly higher education and become one in the future, we've come to the conclusion that it really does not matter to us if we were provided care by a medical doctor versus a nurse practitioner, and that overall our satisfaction, our personal satisfaction would be high with either. However, we know that people of the general population probably have similar misconceptions as we did going into nursing school, and so we're using this as an opportunity to find out what those misconceptions are and overall if satisfaction is higher with physicians compared to MPs because of these misconceptions.
So jumping a little bit into the background, currently medical doctors outnumber MPs nearly 3 to 1, so there is a wide gap. It's thought that there will be a large shortage of medical doctors in the future over the next 10 years due to them aging out and retiring. This shortage of physicians can't be filled by upcoming medical students due to the length of time that it takes for them to obtain their degree. So typically a medical doctor will do 4 years of undergraduate, 4 years of medical school, and then they'll do around 4 to 6 years of residency. So that brings their schooling possibly up to 15 years. While nurse practitioners go for 4 years of undergraduate and then just two years for obtaining their degree. So this increase in length of schooling for medical doctors allows them to have a wider and more well-rounded scope of practice when compared to NPs. So when NPs go to school, they pick what they want to study before entering school, and they only focus on that specific topic once they go into practice. Currently, there are only 23 states that allow full practice authority for nurse practitioners. So what full practice authority is the ability for the nurse practitioner to have their own practice and be completely autonomous. So this means that they're able to open up their own clinic, prescribe medications, and then diagnose diseases. In the states that do not have full practice authority, the nurse practitioner's scope of practice is greatly diminished to where they have to work directly under a medical doctor.
So in order to find effective research articles for this topic, we use multiple journals, including the Journal of Delivery Science and Innovation, the Journal of Congenital Heart Disease, the Journal of Health Affairs, Association of Occupational Health Nurses Journal, and International Journal of Multiple Sclerosis Care. We then refined the search for all of our articles by having a requirement for them to be no more than 5 years old and ensuring that they hit every aspect of our research question, including the fact that the population needed to be under 65 years of age. It was difficult to find articles within all of these requirements, so we ended up including 2 articles that were older than 5 years of age. However, we were able to get permission for that, and they were relevant to every part of our research question, which is why we used them. One of our articles that we used was a level 3 level of evidence, and the other 3 that we used had a level 4 level of evidence. So when picking our studies, we also made sure to pick a variety of studies from a variety of different settings. For example, one of them is from a multiple sclerosis clinic. Another one is from a congenital heart disease clinic. One of them was just in an occupational health setting, and then one was just in a average clinic. So with this broad spectrum of areas, this allowed us to have a better idea of the perceived patient satisfaction in a variety of areas and not just in one area, also increasing our population and allowing our results to be more effective and more broad spectrum. So after reviewing each of these 4 articles, research articles, we came to the conclusion, or they came to the conclusion, that there really is no higher perceived satisfaction rates with either medical doctors or nurse practitioners. Overall satisfaction was really high with both provider types, and yeah, neither one was really preferred over another. However, we did determine that each provider type has their own strengths. So the strengths of physicians or medical doctors really included like trust by their patients. The patients had high levels of trust with medical doctors. They had a perceived increased ability to diagnose complex diseases. They had a perceived higher education, which is true, whereas the strengths of nurse practitioners included they were much easier to access, as in they are often in rural areas, whereas medical doctors are not as commonly in rural areas. So people in places such as Montana are often find it easier to get to a nurse practitioner than a physician. They also have lower costs associated with their care, higher convenience, also related to the rural areas, and they have an improved bedside manner and communication with their patients. So each of these strengths for the provider type proved to have the provider type have high satisfaction with their patients. There was some patients that would prefer a physician just because they put higher value in the trust and education that they perceived the physician to have, whereas there was patients also that preferred the nurse practitioner because they put higher importance on convenience, cost, and just overall communication. But overall, when looking at all of these studies, they were inconclusive in determining if one was overall higher satisfaction than another.
So moving into nursing implications, our main focus was for education of patients as well as advocacy for full practice authority in states that do not have it currently. So determining patient satisfaction rates for NPs and MDs helps healthcare facilities determine the appropriate provider type to hire. We found that typically a lot of facilities are not equal, and if NPs have similar satisfaction to that of MDs, the provider type can be equal. And as stated earlier, NPs are more likely to be utilized in rural areas. So for a state like Montana, this is important because people can travel multiple hours just to see a provider.
Yeah, and with the increased practicability or ability to practice independently for nurse practitioners, especially in states like Montana, where it takes a long time to get possible health care or checkups, it's good for nurse practitioners to be available in these rural areas and to be hired and have their full practice authority so that patients are able to receive the health care that they need without having to travel long distances and whatnot, and at lower costs. We also, with the inconclusiveness of all of these studies, determined that we think further research should be done. And we created a possible study, hopefully in a unit such as oncology or cancer, just as it's very important on an oncology unit that they have high trust in their provider just with the complexity of their disease, as well as effective communication and accessibility and bedside manner, just as there probably will be a lot of patient involvement as well as family involvement. So it's very important to have that communication. So both provider types offer these strengths and in units such as oncology, and so it would be effective to do continuous research on a unit such as this, on multiple oncology units in multiple different hospitals, so that there's a large random population, and increased evidence is used to determine on an equal playing field whether overall provider satisfaction is higher with nurse practitioners or with medical doctors, or if there's a difference at all. And with this study, I think we can further determine or find a conclusive conclusion whether it's more important to have higher numbers of NPs or not. And further education also needs to be provided to patients and their families of the roles of a nurse practitioner and how their scopes of practice differ or don't differ from that of an MD, and where their qualifications meet those of an MD to further develop confidence in the role of an NP and decrease that stigma around care provided by NPs. Overall, we really enjoyed researching this topic. It's something we both have always kind of wondered about and been curious about, and we were both kind of surprised to find that there was really no difference between satisfaction, and that it's not taken into account more often when hiring NPs and utilizing their abilities and level of care. And we do think that further research needs to be completed so that overall NPs are more utilized and better care can be given to patients, so that overall satisfaction is higher and healing probably will improve. So thank you for listening to our presentation and our research on the differences between nurse practitioner and medical doctor satisfaction rates by patients.